Relatable. You have a pounding headache, you swallow a painkiller, and 20 agonizing minutes later, absolutely nothing has happened. So, out of sheer frustration, you reach into the bottle and swallow 2 more. We tend to treat pills like magic missiles. We expect them to teleport straight from our throat directly to the exact spot in our head or back that hurts, neutralizing the pain on contact. But biology doesn't work like that. This graphic breaks down the World Health Organization's strict definition of a drug. It is an external substance explicitly intended to modify your physiological system. And to make that modification, that geometric structure has to physically reach, interact with, and bind to your biology. If you look at this flowchart of the pharmacological ecosystem, you can see just how many disciplines are involved in a single dose. Inside your body is a massive, complex biological network. Any medication you take has to survive a highly regulated internal obstacle course before a single drop of healing can actually begin. Understanding this internal transit system is the only way to realize why medications take physical time to work and why swallowing an extra pill out of impatience is an incredibly dangerous mistake. This anatomical diagram introduces a concept called pharmacokinetics. Simply put, this is the study of what your body does to the drug. From the moment you swallow, your digestive system treats that pill like a foreign invader, traversing a highly hostile package delivery route. This rendering of absorption shows exactly what that looks like. This is phase 1. The medication has to break down, and those blue particles must successfully cross the physical pink tissue barrier of your digestive tract just to get into your systemic circulation. Next comes distribution. As you can see in this cross-section, the bloodstream acts as a chaotic, high-speed highway. Those blue shapes have to migrate completely out of the red blood vessel walls and embed themselves directly into the purple intracellular spaces to reach their target. This brings us to metabolism. Looking at this detailed liver tissue model, you are watching the body's strict security checkpoint in action. The liver chemically alters the drug, turning those blue cubes into green, star-shaped metabolites so your system can eventually utilize them. Finally, there is excretion. This model of a nephron shows the final phase of the drug's movement. Your kidneys act as a filtration gland, grabbing the remaining green metabolites and safely removing them from your body. This entire 4-step process, absorption, distribution, metabolism, and excretion, is known as the ADME logistics network. It must be navigated in its entirety before you feel a single ounce of pain relief. Once the drug actually survives that gauntlet and arrives at its destination, we enter a completely different phase, pharmacodynamics. If the last phase was what your body does to the drug, this is what the drug finally does to your body. In this graphic, we see the moment of therapeutic activation. The blue drug molecule must align precisely with the orange cellular receptor, binding with a physical specificity that triggers the intended biological response. But patients routinely sabotage this final step before it even begins. When you dry swallow a pill without water, the capsule frequently sticks directly to the muscular wall of your esophagus. It halts the absorption phase in its tracks. A full glass of water provides the hydrodynamic force needed to flush the pill into the stomach, ensuring absorption stays on schedule. You act as a supervisor for your own internal transit. Following the bottle's instructions directly controls the speed at which those therapeutic molecules reach their cellular targets. Which brings us back to our impatient patient from the beginning. The person who, tired of waiting for the distribution phase to finish, decided to swallow 2 extra pills. Biology has hard limits. Your liver's metabolism checkpoint has a strict maximum capacity. When you throw a sudden surge of pills at it, the processing system backs up, and the liver becomes completely overwhelmed. This side-by-side comparison shows exactly what happens next. On the left, a healthy cell receiving intended pharmacological action, but on the right, the receptors are completely saturated. The excess drug spills over into non-targeted systems, causing cellular damage and triggering severe adverse effects. This visual sharply contrasts therapeutics and toxicology. On the left, therapeutics is the precise treatment of disease. On the right, toxicology is the study of poisons. The only difference between healing those tissues and destroying them is the dose you swallow. Doubling your dose out of impatience does not double your healing speed. It bypasses therapy entirely and introduces chemical poisoning to your own system. So let's lock in the core rules. First, drugs aren't magic. They are highly complex chemical modifiers that have to survive a brutal internal environment to do their job. Second, your body's logistic system requires actual physical time to process a compound. Patience isn't optional. It is a mandatory part of the healing process. Third, the exact prescribed dose is the only thing keeping your medication acting as a cure rather than a poison. The next time you pick up a prescription, take a moment to ask your local clinical pharmacist about it. Ask them exactly what kind of journey that specific pill is about to take inside you. You might be surprised by just how hard your body works to keep you healthy.